Welcome to our 2021 County Health Rankings and Roadmaps 101 webinar, where we'll be sharing how you can use data, evidence, guidance, and stories to build healthy communities. Hi, my name is Erica Burrows Girardi, and I am a Senior Outreach Specialist at County Health Rankings and Roadmaps. And today I am joining you from sunny Florida. And I'm also joined by colleagues across the nation who's going to help me facilitate today's webinar. And they are they're also going to share, rather, where they are from. I'm going to start by heading to Alabama, where I'm going to introduce you to Dr. Annie Roble, who is our population health analyst with the data team. Hi, Annie.
Hi, Erica. Hi, everybody. As Erica said, I'm in Alabama. I'm just outside Montgomery, Alabama today.
Thank you so much, Annie. And next, we're going to head north. That's right, that's north to the Midwest, where I'm going to introduce you to Jesse Souls, who is an evidence analyst with our What Works for Health team. Hi, Jesse.
Hello, Erica. Happy to be joining you today from Madison, Wisconsin, and we might eventually have a little bit of sunshine.
Oh, that'd be great. That'd be great. Hopefully, it's not too cold there today.
Wasn't too bad this morning. Always a good thing.
Oh, good, good. And rounding out your team of facilitators today is Joe Hinton. And Joe, where are you joining us from?
Erica, I'm in Sedona, Arizona, where I can count the clouds on one hand. And I'm also the person for all of you who are hanging out in the chat. I'll be chatting with you a lot today. And if you want to make sure we see your message, make sure that comes to all panelists and attendees. So I look forward to interacting with you in the chat.
I appreciate you, Joe. And Joe is our research and learning specialist. And I also want to introduce you to James Lloyd at our home base, who is our technologist and who graciously supports us in all of our webinars. Hi, James.
Hi, Erica. It's so great to be here. I really enjoy the opportunity to support these really worthwhile causes in our organization. I am in Dane County, Wisconsin. And if you have any technical questions, please feel free to message me in the chat to James Lloyd, and I'll do what help I can.
Thanks, James. I also want to let you know that there are other staff members who are going to be in the chat or in the Q&A box. Like Joe said, place all of your questions that you may have in the Q&A box, and they're going to be there to answer your questions. This is going to be a very packed, well-informed webinar, and so you may have lots of questions. So make sure you put those in the question box, and we do have staff that are going to attempt to answer your questions live on the spot. So I want to thank Christine, Michael, Matt, and Keith for helping us get your questions answered today. I want to next share some learning objectives with you. By the end of our time together today, our goal is to answer these three questions. Just who is County Health Rankings and Roadmaps? What is it that we do? And equally important, why does it matter? And lastly, I want you to leave with an understanding of how you can use the tools and resources that we have on our website to improve health in your community. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute, and the program is the result of contributions of many colleagues around the nation, as you just saw, partners as well in Wisconsin and across the nation, including the Robert Wood Johnson Foundation. We are committed to improving health outcomes across communities in the United States, and ultimately, County Health Rankings and Roadmaps strives for people to live longer and to live healthier. But to do that, health equity has to be at the center of our work. Equity demands that everyone, regardless of where we live or the circumstances we were born into, have the opportunity to make healthy choices. So, another important goal of ours is advancing equity. Our goal is to equip you with the resources and tools to create healthy environments where everyone has a fair and just opportunity to live a long and healthy life. To accomplish both of those goals, improve health outcomes and advance equity, we encourage community change makers just like you to start with data to identify who isn't thriving. Then we point to evidence to share what is working. What does the research says creates change? Then we share guidance to help all change makers begin to take steps to action, actually creating that change. And then lastly, we offer stories to help uh, give you real life inspirational examples of what community change looks like. So I like to think of county health rankings and roadmaps as being a bit comprehensive in that our goal is just to provide you with those tools and resources that's going to take you from data to action. Again, we want everyone to have an opportunity to thrive, no matter what zip code you're in, no matter the color of your skin, no matter your age or any other aspect that makes us unique. We all deserve the opportunity to make healthy choices. Again, this webinar is going to be chock full of information. And again, I want to encourage you to put your questions in the Q&A box, but I have to be honest with you, we may not get to all of those questions. So following today's webinar, my colleagues and I will have a Zoom meeting, and we're going to go over from the webinar to that Zoom meeting to answer any questions that you may have about data, our evidence-rated strategies, or the guidance that we offer. We are going to share how you can connect to that Zoom meeting toward the end of the webinar. But if you have time, I would encourage you to plan to join us over there immediately after the webinar. And with that, I am going to ask Annie to come back to the mic to share how we are supporting community change with data. So welcome back, Annie.
Thanks, Erica. Give me a second to share my screen there. I think it's showing for
Yeah.
you now.
Yep, I see it.
Okay, perfect. Okay, so at County Health Rankings and Roadmaps, we've been publishing data on the health of communities and counties since 2010. And data is an extremely important resource, as Erica noted, for communities because it can be used throughout formal and informal community health improvement processes. How have people used our rankings data and how do people use data in general? Well, they've used it to assess the health of their community. They're incorporating county health rankings data into community health needs assessments, grant funding opportunities, and other health improvement strategies. It can also be a tool for engaging non-traditional community partners and community members in the health improvement process. Data can also help identify root causes of health issues, support decision-making and policy change, and track progress. As communities take action, they've used data from the rankings and other data sources combined together to help understand whether policies, programs, or plans are on track to improve health. So I want to share with you briefly what we've remained committed to over our past 10 plus years and where we're focusing our work in the next few years. This is our model on the left, and that's remained relatively unchanged over that time. But our commitment to understanding the multiple determinants of health has really remained strong, as well as working to reduce inequities and supporting communities in using data to improve health. We think of data as one of the tools, not the end-all be-all for health improvement. So our model shows that multiple determinants of health, not just the availability of clinical care, determine health outcomes for communities. The measures that go into our model fit into the categories of health behaviors, clinical care, social and economic factors, and the physical environment. And we rank over 35 measures of health. And we also have additional, just as many additional measures actually, that also fit into these categories. So we believe that programs and policies, that orange box on the bottom, influence health factors, all those blue boxes, which then in turn influence health outcomes. And as I said, we rank the health of counties. And so we provide both a rank for health outcomes and health factors. And health outcomes are things like the length and quality of life. And we typically refer to those as a picture of today's health in the county that you live in. Whereas health factors represent what we consider tomorrow's health. So how those length and quality of life will be impacted by things like health behaviors, social and economic factors, the physical environment, and clinical care, just like our model shows. And so this graphic was actually introduced new this year. It's a graphic that breaks the county health or the ranks for your state into quartile graphics. And we find that comparing to others in this way can be a really useful tool to think about where your county is performing or how well your county is performing compared to others in your state. But true to our name, we are the county health ranking. So we also provide a unique rank for counties. And I'm going to give you a live web tour in just a second, but I wanted this to be in the slide deck. So that's why I'm going to show you here how to find those ranks. So on a snapshot, at the top, you see those quartile graphics, but on the left, you'll see the show rankings button in orange. And I've highlighted it there. And if you click on that, it'll slide over those list of counties, and we rank counties within states. So I'm showing you today my county that I'm in, Autauga County, Alabama. And you'll see that I'm listed first alphabetically, but also that I'm ranked 6th out of 67 in Alabama. So we released our new data this year. Our 2021 release happened on March 31st. So if you haven't been on the website since then, there's new data available for you. And again, we provide both a health outcome and a health factor rank. And the outcome rank measures length and quality of life within a state. Again, I rank 6th out of 67. And the map here is one of the tools we use on our website to convey those ranks. Again, it matches those quartile graphics that I showed before, just in map form. And so you see lighter color counties are those that are ranked healthier, so the lower ranked counties. We also rank health factors. And so here, my county, Autauga, ranks 9th out of 67. And this is a combined measure or a combined rank for measures such as education, adult smoking, severe housing problems, children in poverty, and the ratio of primary care providers, as well as a number of other measures. There's 30 that go into that rank. But if your overall health outcomes rank is better than health factors like mine is, it might suggest that if we take no further action, we might see a decline in health in the future. And so we can kind of play these two ranks off of each other to tell us something about health in our community. So how do we actually calculate the ranks? Well, we use data from over 20 sources. And these are county level metrics that are available nationally. And we use the most recently available data in all cases. We also choose to use data that's publicly available and at no charge. We do calculate some of our measures in-house, but most of them are actually from our data partners, other data stewards across the US. And all our measures are reliable and valid. We have a pretty rigorous process in terms of lit reviews. I'm thinking about how measures correlate with other measures in our model and how they correlate to health outcomes, as well as if they're able to, if a community might be able to work to improve on that measure. And I want to just note here on this most recently available bullet point that for our measures this year for the 2021 release, we have death data through 2019, December of 2019. So that means we don't currently have COVID-19 death data in our model, excuse me. And so we anticipate that next year we'll have that death data, or we'll have death data from 2020, which will include COVID deaths. As we know, the first recorded death in the US happened in February of 2020. So that data is not available yet. So at County Health Rankings, we develop snapshots for each county, and we think of these snapshots really as a data product, as kind of our output for you. And there's a lot on the snapshot itself, so this is just a picture. But I want to highlight here what a snapshot can tell you before I go live to the website to show you one. And I also want to note that there's a lot of data here. And so it can be kind of overwhelming to pick through and pack through what might be important or where you should focus your time and energy. And Joe's going to talk about our action learning guides in a little bit, but we have 3 that we've developed related to data. And in particular, the worksheets can be really helpful when trying to think about how to look at your snapshot and harness the data that's there to drive action. So again, we provide a snapshot, and we're looking at just a quick picture of my Autauga one, and I'll go to it in a second again. But when we look at our snapshot, what we typically do are these 5 steps. So the first is just to get a sense of the big picture of health in your community. So your health factor and health outcome quartile can help you do that, as well as the rank itself. So do you rank where you'd expect to be? Are you better? Do your health factor and health outcome ranks line up, or is one much better than the other? Those are the kinds of questions we think you should ask. Then you might want to look into the measures themselves. Really think about which ones are the strongest, which could use some work. And here you can compare to the top performers, which is the top 10% of US, which I'll show you where to find it in a bit, as well as your state level values. So those can be helpful comparators. Third, we think maybe you'd look at your trends. And so we provide some trend data over time, as well as you can go back through your snapshot over time if that's useful. And really think about if a measure is improving or worsening or staying the same. And compare that again to counties similar to you, that if they're improving and you're worsening, what might have been happening in your county during that time. Fourth, you can look at measures disaggregated by race and ethnicity. So this really helps when we start thinking about disparities in your county, and really can help you with a priority setting process for community health improvement. If you're going to work in a specific health area and you see that one race and ethnic subgroup might have worse data there, that might be where you need to spend those resources to really improve health for everyone. And last, we have areas to explore and areas of strength. And so our team does some statistical work on the back end to kind of identify measures that are particularly strong or maybe particularly weak compared to other counties similar to you. And so this isn't intended to replace a true priority setting process, but it can be a good place to start if you're not sure which measures to start working on, or it can be a good comparator tool to look at, here's my community health improvement plan, and we've picked these areas. Is this what we've identified as similar areas, and kind of work through those questions. So now I'm going to go live to the website. So I'm going to stop sharing my screen and share the website.
And Annie, while you're doing that, I just want to thank you and everyone on our data team for the fantastic work you've done with our 2021 refreshed rankings. And for those of you who are new to county health rankings and roadmaps, you know that every year we refresh the rankings. You also know, as someone just noted, I think it's Debbie noted to the panelists, we rank the counties of over 300 counties. We rank the health of over 3,000 counties. So Debbie said in the chat, it's like, you guys are really, really busy. Yes, the data team is very busy with the work they do. So thank you so much. And what you're seeing now is the live website that that we refreshed starting on March 31st, right, Annie?
Yes, so thanks, Erica, and thanks for noting our work. It's a great team of people on the data team that work on it. But yes, if you've been to our website in the past, you will notice that our homepage has been slightly changed, and we called it a refresh this year. So we also refreshed our homepage. So feel free to check out some additional resources there. And I'm going to take you to the data part. So if you scroll down slightly, you'll see the How Healthy is My Community button. You can type in either your county name, your zip code, or your state in that box, and it'll take you to your snapshot. So again, just like I showed you in the snapshot, you'll see here the health outcome and health factor quartile graphic. And then on the left, the show rankings button. I'll just turn it on to show you. And then if you keep scrolling down, you see the snapshot. And I'm going to let you know, I'm going to go through the snapshot from top to bottom, which is not the 5 points that I mentioned before, but that's just so I don't forget anything, because there is a lot of stuff here. And hopefully I don't make you sick with scrolling. So we will attempt. So first is below the graphics there is this download Alabama rankings data, and that takes you to an Excel file for your state. And this will have all your ranks, all the measures for all the counties in your state, as well as all that disaggregated data. So that can be a useful tool depending on how you're using the data. Below that, you see those areas to explore and areas of strength. So I'll just turn them on and scroll down slightly so you can see they highlight measures in orange and purple respectively. And then you get to the snapshot itself. So I just want to take a minute to orient you here for those who are new. The first column there on the left is all our measures, and all the measures you see right now are the ranked measures, so those 35 that go into the ranks. Underneath them, you'll see these sort of gray boxes with a plus sign. So you can open those, and we have those additional measures under each of them. So if there's a measure you're looking for that you don't see right away, feel free to check in those boxes. We actually have additional measures for all of our health factor areas and health outcomes. And so the next column then is your county's value. So my county, Otaga, YPLL rates or premature death is 7,800 years of potential life lost per 100,000 population. And any of these measures that's blue and underlined, you can open up and it'll have that disaggregated data underneath it. This could have up to 5 races, race or ethnicity groups. Mine has 2 because those are the reliable data points there. The next column is a trend column. And so anything that has an icon, any measure that has an icon, it could be yellow, green, or red, will show trend data over time. And I'll just open that up to show you. So this is the adult obesity in my county. You can hover over any of those data points and it'll show you it, or you can click on them in the legend and that'll turn on those data points. We're really excited about the fact that these are interactive this year, so feel free to play around with those. You can also download this image with or without any of the data points on them. So if it's useful for you in a presentation or a report to use it, feel free. As well as if you're data savvy and want to play with these trends, the data can be found here at the bottom. It'll take you to this CSV file for them. So for instance, if you're only interested in your trend from 2012 to 2017 and you want to recreate this, you can do that. We provide all the data years that we have available in these graphics, so some of them get pretty long. The next column is the error margin column. So this is the error margin around your county's value, 95% confidence intervals. And then the next column is the top US performers. And these are the top 10% of counties in the US. And I like to think of these as what value you would have to get an A for that specific measure. Then we have your state's values. So for me, it's Alabama on all those measures. I'm going down. So these two can be good comparators. So you can see for YPLL, my value is better than the Alabama value, but I'm not quite doing enough to get to that top US performer value. So just a good interplay across different measures and good comparison tools. I'm going to scroll down to the bottom. I just want to point you to the new measure we added this year, which is broadband access, which is actually the bottom. It's in physical environment, so it's the last measure listed, but we added this measure this year because we know the importance of broadband access for health in terms of health care and the internet now with the pandemic for education and employment. So we encourage you to look at that measure as well. For those who have been here for a while, that measure is our new one this year, one of the new ones. The other thing I want to point you to is the Compare Counties tool up top. So it's in this tab. And if you click on it, it'll bring up the snapshot that you're in. And you can either select from a list of peer counties. So I'll select Elmore here, which is my zip code actually goes in both counties, but you can actually look at 2 counties side by side. You can look up as many as you want side by side. I think I've looked up over 12. So if it's helpful for reports to print them out this way, that might be helpful rather than printing out different snapshots. Or you can select any other state and any other county to compare it to. So whatever is useful for you, just so you know that tool is available. I'm going to scroll down. I want to take you to a measure page now, and I'm going to take you to teen births as a good example. So on any of our measures, you can go to a measure page and it'll take you to a map first of your state. So the counties in your state, again, those lighter color counties are the ones with better values. And if you hover over any of the counties, it'll change the values. You'll always see the data years we used on the left here, which could be a good reference, or up above. The data tab then has all the data for your county for that measure. And you can sort it by county, by the value for that measure. There's also error margins. The z-score is the tool we use to actually calculate the rank. And then those 5 races where the data is reliable could be filled in there as well. The next tab is the description tab. And here we provide things that we think would be useful for you to know if you're looking at this measure. So first, there's a reason for ranking, which is kind of a mini lit review of why this measure is important to health. We have all the sources there and you can link to them below. But just to give you an idea of why we actually include this measure for ranking or as an additional measure. Below that is a measure methods section. So this includes anything you could want to know about our measure. So if it's a rate, an index, a ratio, we include that there, as well as things you might want to know, like why data are suppressed, any measure limitations, etc. But the two things I really want to highlight here are the track progress and digging deeper sections. So track progress talks about, can you use this measure to track progress over time? If you're doing a health intervention, should you use it as a metric? And if you can, we might offer some nuances or things to just be aware of when you're kind of making your, or talking about your results. And then digging deeper really talks about if you need data at a more granular level than the county. So if you want to look at by age within your county, or gender, race, education, or income, or even sub-county area, so census tract or zip code. If there's a place where we've identified a data source that does that, we've linked them below. And so you can go and explore those as well. So just some additional resources for you to know about. There's also a data source tab, which just talks about the data source. And then the strategies tab. And Jesse, my colleague, will talk about this in a little bit, but just a preview. If you're working in a specific area and you want to find strategies related to teen births, here's a place you can start to do that. The last thing I want to show you on the website is if you go and explore health rankings, you can see the find county data, and you can type it in. It's another place, another way to get there to your snapshot, but you can also use the data section here. So if you click on learn more, over on the left, you'll see basically this is a hub of all our documentation and a hub of helpful resources to help you think about using the data. So I just want you to know it's here. So if you want to use the data, if you're thinking about what's in your snapshot, or if you want to pair that with something else outside of the snapshot, we give some guidance on that, as well as a detailed about our measures and data sources, how we actually do the ranks in the R method section, again, measuring progress, and then rankings, data, and documentation. So here you'll find all our data if you want a national file, or that trends data or analytic data, or if you want more specific reference, things like national reference tables or comparability across states, etc., can all be found there. And so that was a quick web tour, and I'm going to switch back to my other screen now. So give me 1 second.
I appreciate that great thorough, it's actually a very thorough tour of at least how you can get into our data snapshot. So lots of questions coming in the chat, and we appreciate those. If you could transfer your question to the Q&A box, so they're more likely to be responders there to answer them than they are in the chat box, because Joe is in the chat.
Thanks, Erica. Glad
All
to hear there's
right.
lots of
Thank you.
questions, and another plug
Yeah,
for our after class or
right.
meeting afterwards if you want to find something
That's
more
right.
specific. So let me go to the next slideshow here. Okay, so state reports. So for those of you who this might not be your first release with us, I just want to acknowledge in the past we've had state reports. We've had state reports available that are pretty robust and centered around a specific topic like housing or children in poverty. And we don't have a topic like that this year because we didn't want to deter from any of the work that our community partners are doing on the ground, or our great public health colleagues in regards to the pandemic. So, but we did produce the data tables that go along with that. So if you're interested in state level data or you need it as a comparator, the place where you usually found state reports in the state downloads is where you could find those state tables. There's also state race and ethnicity data there, which we haven't had in the past, as well as a really good technical note about how we think about race and ethnicity in the county health rankings, as well as some nuances of how our partners define it, or define the different groups. Two other things I just want to draw your attention to quick from the data team. One are data spotlights that are coming out, and these are going to be coming out regularly throughout the year. And I really wish I could have had a cool graphic to show you here, but I can't because they're going to be interactive. So hold tight and be excited for that like we are. And the first one of these is going to come out at the end of the month. It's going to be on children living in poverty, and we're talking about disparities by place and race. And like I said, there's going to be an interactive visualization, as well as things to think about and consider when you're looking at that data. Each one of these will highlight one of our measures or a data point from county health rankings. So we're really excited to release these this year. And like I said, the first one's coming out at the end of the month, so stay tuned for that. The other thing to draw your attention to is a call for research proposals, which will be coming out pretty soon. And I think Erica will chat out the link to where they will live on the website. The call is not live yet, but it will be soon. And you can see who we funded in the past at that link. But if you are research minded or you have colleagues that are research minded, please pass this along to them if they want to think about ways we could improve our measures or our methods or the way we measure health equity in particular. That would be really helpful and we would appreciate it. So rankings are a great starting point to draw attention to the problems that matter in your community. But we don't want you to stop at the data. We really want you to use the data and use and harness it to drive action in your community to improve health. And with that, I'm going to turn the presentation back to Erica.
Yeah. So thank you, Annie, so much. And we still have much more for you to learn about what it is that we offer. And I know you're like, oh my gosh, there's more to come. Yes, there is more to come because community change starts with data, but you can't change because you can't change what you don't know needs to be changed. But once you have data in hand, of course, you want to create change with confidence, and that's where What Works for Health plays a role. So Jesse is now rejoining us to tell you about What Works for Health and how you can use this very valuable resource in your community change effort. So welcome back, Jesse. And I see your
Thank
What
you
Works
so
for
much,
Health
Erica.
page.
Oh, great. Sorry, as I was getting that set up, the mute button jumped to a different part of the screen. So always a fun adventure with our webinars. But thank you again for having me to talk about What Works for Health. What Works for Health is an easy to use online tool to help you find policies, programs, and system changes that affect the factors we know make communities healthier places to live, learn, work, and play. Listed under Take Action to Improve Health, this is the What Works for Health homepage, which features the health factors from the CHR&R model arranged as topic areas, seen here within the orange box. You can click on each topic to explore different ways to take action to improve health and well-being within communities. What Works for Health includes over 400 policies and programs, which we refer to as strategies. What Works for Health is a living resource as our team of evidence analysts are continually updating and adding strategies to our website. For each strategy, we include an evidence rating, which conveys how likely a strategy is to work based on the best available evidence, a description of the program or policy, a short summary of the evidence that highlights who a strategy can benefit, what it can do, and, as we have it, information about cost, and a disparity rating to help communities use an equity lens as they explore strategies. You will also find implementation examples and resources to move from idea to action. When we examine the literature supporting a strategy, we think about three main things: the type of studies available and how well they demonstrate causality, how well each study is conducted, and the number of relevant studies we found, while considering if we see results replicated across studies. This all contributes to our evidence ratings, which are a quick way for you to assess what the evidence says about a strategy. What Works for Health rating scale has 6 evidence ratings, ranging from scientifically supported, which is the strongest evidence of effectiveness based on systematic reviews, meta-analyses, and randomized controlled trials, to expert opinion, which is based on promising theory and limited practice, all the way down to evidence of ineffectiveness for programs that have been conclusively proven to not work or to cause harm. The temperature gauge shown here illustrates the effectiveness of the evidence rating at a glance. Green for stronger, positive ratings, yellow indicating something is promising, but there's still more to learn, orange showing that there isn't enough research yet for us to draw conclusions, and red for mixed evidence, meaning a combination of positive, negative, or neutral outcomes. The temperature gauge is included on each strategy's page as well. However, please don't treat the temperature gauge as a traffic light and only move forward with green strategies. Strategies rated expert opinion, noted in yellow, are recommended by credible experts and based on promising theory and practice. Strategies rated insufficient evidence, noted in orange, are often so new to the field that they are based on only one or two sources with limited detail about their effects. This isn't enough evidence for us to conclude if they could have a positive or negative impact. As more communities and organizations implement strategies across our evidence ratings and publish their findings, there will be more research for our evidence analysts to evaluate and potentially raise a strategy's rating and add additional detail. As a reminder, when you are considering which strategy to implement in your community, use the evidence rating as a guide and also consider the goals and context of your community. In addition to the evidence ratings, we also provide disparity ratings, which tell us how likely a strategy is to work well for different groups, essentially closing gaps and promoting equity. What Works for Health has 3 disparity ratings: strategies that are likely to reduce differences in health outcomes, essentially close a gap, are rated likely to decrease disparities, while strategies likely to exacerbate differences are rated likely to increase disparities. Strategies that generally benefit entire populations are rated no impact on disparities likely. The word likely in our ratings implies that this is an area where evidence is still emerging and we have more to learn. When we assign this rating, we currently consider disparities or gaps across 3 domains: racial or ethnic groups, socioeconomic groups, considering low versus high socioeconomic status, and geographic areas, which include urban, suburban, and rural. Disparity rating is an important feature of What Works for Health, and we're currently working on improving our methods and adding more diverse subpopulation groups, such as age groups, gender groups, and more, so please stay tuned. Now that you have a sense of what you'll find in each What Works for Health strategy, we'll walk through a quick example search to illustrate how you can narrow your options. Returning to the What Works for Health homepage, you'll see once again that we have the option to find strategies by topic. Below that, in the area indicated with the orange box, you'll see you may also search by keyword for concerns that could go across topic areas, such as opioids, obesity, or low birth weight. This keyword search is available within our strategy list pages as well, which you'll see in a minute. Now, let's think about how you might use this. Circling back to one of the new measures included with this year's rankings refresh, children in poverty, let's say you work for a health foundation, public health agency, or a nonprofit, and you're interested in improving one of the most tangible experiences of children living in poverty: housing. However, you have limited time to research all the ways your organization might increase access to quality housing for families with children. You can use What Works for Health as a collection of strategies to get quickly acquainted with the research and your options. Let's take a look at the housing and transit topic area indicated by the arrow. It's one of the topic areas that could fit what we're looking to explore. When you click on housing and transit, it pulls up 38 strategies. Right away, in the alphabetical list, you can see that the strategies included deal with topics beyond just quality housing. As a next step, rather than looking through the list, we can use a keyword search to hone in on strategies which might better fit our topic of increased access to quality housing for children living in poverty. The keyword search box is at the top left of this page, shown with the orange box, and will search across all of What Works for Health strategies. To narrow our results, we can search children in poverty in the keyword search box. This gives us 22 options, which is a much more manageable list to look through. By clicking on Sort By at the top right of the list, indicated with the orange box, we can look at the newest strategies within this keyword search, pointing us to a couple of relevant strategies from housing and transit. Let's take a look at the first option: debt advice for tenants with unpaid rent. Now that we've narrowed our search to a specific strategy, I'd like to point out a few features of What Works for Health strategies in general. Right away, you'll notice the strategy includes the evidence rating and description at the top of the page. Here, you'll also find our new Save This Strategy and Print This Strategy buttons, which are located just below the strategy's title. All the strategies you save will now be collected in a strategy shopping cart at the top right of your screen, which you can download or share with others via email. This makes it easy to keep track of the strategies that you're interested in. A more subtle new feature, but one our evidence analysts are particularly excited about, is our new footnote citation style, which really streamlines our entries. Clicking on the superscripts will bring you to the appropriate citation at the bottom of the page. Each of our strategies includes a reference list at the end of the page, so you're able to look at all of the research that we referred to in the entry. Finally, I would like to highlight What Works for Health's new curated strategy lists. Accessible from the What Works for Health landing page, these collections support community change efforts around specific topics and themes that stretch across health factors. They can help address complex health problems, systemic social issues, and local community needs and priorities. So far, our curated strategy lists include COVID-19 recovery, climate change, and violence prevention and community safety. Please stay tuned for more curated content. Our goal is to make it easy for you to find what you're looking for. Now to summarize, I'd like to point out some key takeaways. What Works for Health's evidence-informed strategies include evidence ratings, disparity ratings, and more. What Works for Health provides information about what works, what might work, and what does not work. What Works for Health strategies reach across sectors and are used locally and nationally by decision makers in communities, local health departments, state legislators, students, and more. We hope you'll reach out to us if you need further insights about how to make this resource work for you. And now I will hand things back to Erica.
Thank you so much, Jesse. I want to also mention that What Works for Health will be producing their own 101 this year because, as you can see, that resource is so rich. And so Jesse will be leading that effort, and stay tuned for when that recording will be available so you can really dig into that What Works for Health resource. But thank you so much, Jesse. And yes, there's even more for us to share with you. So now I'm inviting Joe to come back to tell us about how you can use guidance and stories to take action.
Thank you so much, Erica. They've let me out of the chat, everyone. I'm out here live and in person with all of you, but I'll see you in the chat in just a moment again. But I wanted to come out and I wanted to just say also how in awe I always am of hearing about the work of our data team and our What Works for Health team. So what I'm here to tell you about is how to take some of those items, your understanding of data, your understanding of the strategies, and turn them to action in your community. So the first thing that I want to tell everyone about today is our Action Center. Now, our Action Center has been around for a little while, but I just want to remind you that it's a great place to check in as you're looking for step-by-step guidance and tools that will help you move from data to action in your community. We like to think of our Action Center as a just-in-time resource. So if you have a question that's on your mind, perhaps it's about choosing an effective policy or program and working with What Works for Health a little bit. You'll find things there. If you see tab number 3 on our Action Center, you can investigate that, and there's some tools and activities and guidance that you can practice with to understand more about your work. We also like to think that whatever stage you're in, you'll find something here, some way to practice, some activity to practice with, and some way to grow in your work. The new item that I would like to call out in the Action Center is we were inspired by What Works for Health, and we decided that we wanted to develop a curated list of resources for the Action Center as well. So you'll find a new curated list, as you see in the lower right-hand corner of your screen there, that is for folks who are just getting started with taking action. So if you have new coalition members, if you have new partners on your team, if you have new people who are really maybe pretty data savvy or pretty strategy savvy, but they haven't worked with community quite yet, that's a great little sampling of some of those tools so that you can get started and move to action with all of them. The next item that I want to tell you about are our action learning guides. And I really appreciate Annie giving a commercial a little bit ago about the action learning guides. We tend to think of our action learning guides as a just in case resource. So these will take you a little bit more time to go through, a little bit more of a measured process, a chance to reflect. What you're seeing on the screen right now is that we've developed worksheets that would allow you to individually track your thinking and your reflections on a particular topic. We've also developed some graphics to help support your understanding of the material. They're full of videos, they're full of photos of some inspiring communities that will help give you a chance to think about how you put this into action. Annie gave a commercial for our data series of action learning guides. I hope you'll check them out. We also have a terrific series on introducing people to the idea of equity and understanding and identifying the root causes of inequities. And I really want to call out the data guides and the equity guides because this year we launched some new facilitation materials to support those guides in particular. So if you would like to do some group facilitation with virtual or non-virtual audiences, you can use our facilitation materials. There's slide decks there that are available. There's some great reflection questions that a facilitator could lead their group through in order to develop a more group mentality and group understanding on particular topics. So we hope that you'll use those, you'll dive into them, and just a personal commercial, if you use them, I'd love to hear from you. So I hope you'll reach out to me and let me know how that process has gone. My next slide here is in reintroducing hopefully all of you to the Partner Center. So part of taking action is making sure that we keep the mentality that the actions of improving health and improving equity is the role of everyone in the community. So the Partner Center helps you answer the question of how you might engage with sectors that aren't yet at the table with you as you are working towards health and equity. So imagine that you work in the public health space. There's a tab that we've created in the Partner Center that has some messaging and some ideas that are specific to connecting with public health. But let's say you're thinking, oh, I don't have enough representation of the local government in my coalition. Maybe you'd spend some time on the government tab in order to think about some ways that you start to speak about health and all policies and start to think about incorporating a mentality of health and equity in your local government. So we hope you'll check out the Partner Center and think about ways to engage with more people in your community. And then I'm going to switch mentality here for just a second and take you to a different tab in our website. We've been spending time in the take action space. We think that another really valuable aspect of health and equity in community is sharing stories and learning from others. Of course, our webinars are one place that you can do that. And all of you who've registered for this webinar and hopefully for future webinars know that we love to lift up the stories of people who are doing the terrific work of improving health. So we hope you'll visit our stories. We hope you'll read them. We hope you'll interact with the webinars. You can go back and watch old ones. You can stay tuned for new ones. And I always tease Erica and say that I'm sure that the next amazing guest on a webinar is in the audience right now. So I see there's 630 of you here. So I hope you'll all be using the Contact Us feature on our website to let us know when you're really excited and inspired by the work you're doing, and that we might be able to connect with you in the future. And then the last thing that I want to lift up today is some of the new resources that our colleagues at the Robert Wood Johnson Culture of Health Prize have been working really diligently on. The Culture of Health Prize, as many of you know, elevates communities around the United States that are at the forefront of advancing health and opportunity and equity for all. Prize-winning communities have placed a deep priority on health and are creating terrific, powerful partnerships. I know we have someone from the Bronx who was interacting with me in the chat today. They're a terrific prize-winning community from 2015. But I hope you'll check out this report from the Robert Wood Johnson Culture of Health Prize, our Actions Towards Equity report. Great insights and inspiring material from the first 5 years of prize winners. Another great way to think about ways that health improvement is happening around the US. So I'll end my little time here with just some quick reminders. I want you to check in on that Action Center to look for your step-by-step, just in case guidance to take action to improve community health. Those action learning guides and their facilitation materials offer a deeper opportunity to learn and reflect on topics of health and equity. The Partner Center will help you think about your stakeholders, your engagement with other sectors. So we hope you'll dive into that to find the right partners to move towards health and equity alongside with. And then we hope you'll share your story and investigate other stories to help ignite thinking about possibilities and how to best inspire action. So I appreciate that I had a chance to spend some time with you today, and I'm excited to bring Erica back into the front.
Thank you so much, Joe. I so appreciate everything that you all have been sharing, and I hope you all have gotten an idea of what it is that we have to offer at County Health Rankings and Roadmap. So thank you, Ann, Jesse, and Joe. I hope that we have hit the mark with you today. I hope that you have found the information helpful. And with that, I'm going to ask James just to launch a quick poll. Just take a second. It's really just completing a sentence. And I'm curious, well, we are curious if you would say that your understanding of CHR&R resources has significantly improved, moderately improved, a little improved, or not improved. And this is an anonymous survey. We don't even know what your answer is. We don't have access to that. But if you would just share that, and because we're just curious, we're not even sharing the results with everybody. It's truly just for our selfish egos, I guess. But also, there is one thing, James, if you'll just leave that up for about 10 more seconds. And then Joe is actually going to chat out another evaluation. This is a more in-depth evaluation survey that he's going to chat a link to. And if you could complete that on your own time a little bit later, so you can open up the survey and then complete it later. I will let you know that we actually do take your feedback from these surveys to heart. It is actually one of the best ways that we're able to figure out what content is important to you, and that we're presenting content that is meaningful to you and relevant to the work that you do. So I am going to ask that you complete that in a second. Now, lots of you have had lots of questions. We are going to try to get, our respondents have been trying to get to as many as possible. If you have a question in the chat, I'm going to ask you to please transfer that to the Q&A box, because we're getting ready to ask a couple of those questions in a second. And in the meantime, I do want to, before we go there, tell you about a very, very important two-part series that's going to happen in May and June. And in this graphic, you can see our UWPHI director, Dr. Sherry Johnson, is stating that racism fundamentally shapes our economic, social, and physical environments, and sweeping change is needed. I want to ask you, who's going to create that change? We are. All of us participating on this webinar is a change maker. So I invite you to dig into this series with us over the next 2 months. Our Advancing Racial Equity series will explore the role racism is playing in limiting health opportunities across the United States. And each webinar will feature national and community guests sharing guidance and their experiences advancing racial equity. Next month in May, we're going to hear from Dr. Renee Kennedy. You may know her. She is the CEO of the Michigan Public Health Institute. She will be here with us, as well as Jennifer Harris, who is with the County of Milwaukee, and they will be sharing what does it mean to make a declaration that racism is a public health crisis. And how do those declarations advance racial equity? So these webinars are going to be fantastic, folks. I don't want you to miss them. You can find the link to the webinars on our website that Joe is either chatting out or has already chatted out. And I will let you know that May webinar registration is available right now. So please do take some time to register for that later on today. With that, I'm going to hush because we have a couple of questions we want to get to. So, Annie, very quickly, we
Yes,
had a
Erica.
question for you. This question actually came in during the registration process. This person wanted to know what measures or what data can we use to better engage our communities to measure progress, particularly if we want to focus on health equity or COVID-19 recovery? Great question.
Ooh, that's a great question. I'd love to think with that person on that question too. But I think there's a lot of our measures that you could use. Obviously, as I mentioned, we don't have COVID death data yet. But when we think about the context of our work, children in poverty, severe housing problems, all surrounded those issues that we're seeing, and can really think about community context in terms of COVID-19 and health equity. So those are two I'd lift up. I would also encourage people, because I know we're limited on time, if you go on our homepage, there's a message to the field where we actually talk about some of that, particularly the equity work, but also equity situated in the response to the pandemic. So our message to the field will answer some of that. But if we're also happy, use the contact us button. We're happy to talk through specific measures as well.
Yeah, and I've put that contact us link in the chat a few times. Listen, I know a lot of you on this webinar are new, and so if you haven't gone through your snapshot yet, consider opening up your snapshot later on today or tomorrow. And if you have questions, use that contact us button. I will tell you, the very first time I went through my snapshot, I was blown away. It's a lot of stuff there. So don't hesitate to reach out to us and say, listen, I want some help, the one to help me navigate this snapshot thing. So please do that. Jesse, I have a question for you that came in about what works for health. This person wants to know how can what works for health evidence-informed strategies support equitable health outcomes, including that COVID-19 recovery. So there's a lot of questions about COVID-19 recovery, and rightfully so.
Absolutely. So the first resource that I would point the asker to is our COVID-19 recovery curated list. It is accessible from our homepage. If you go to the curated list section, we have 150 strategies that have been noted as, I know, isn't that amazing? As having a positive impact on COVID-19 recovery. They go across all 13 of our health factors. It includes things from the retail clinics that are giving out COVID vaccinations to the strategy I highlighted in my section, debt advice for renters with unpaid rent. We have things in family and social support, just a whole wonderful amount of programs and policies that you can make use of. And for the equitable piece of that, each of the strategies does include its impact on disparities, which will be listed very, very clearly towards the top of the page. And then within the individual strategy, there's additional information about if there's specific populations that have been found to really have an improvement in their disparities rating. So encourage you to take a further look.
Well, I appreciate that, Jesse. And you all can see that I was even astounded. 157.
It's
Wow.
been going up, which is really exciting.
I mean, listen, these folks work hard here at County Health Rankings and Roadmaps. Listen, I appreciate all the questions that have come in, and just like I was afraid we weren't going to get to all of them. So I do want to invite you to come back to come to that meeting that we're going to all head to in a few minutes. And Joe's going to go ahead and chat that link out. But I want to let you know we have a presence on Facebook. You can follow us on Twitter. And I always encourage people, please do sign up for our newsletter, because this is the best way that you're going to find out information about our upcoming webinars, those resources, that 101 that Jesse's working on for What Works for Health, those data bites that Annie was telling you about. We have chock full of resources that are still coming out. And the best way to find out about it is through our newsletter, because we will always announce them in our newsletter. So go ahead and plan to come to that meeting. And I want to thank all of the responders who've been very busy in that Q&A box. Thank you so much for answering questions. Thanks to Annie and Jesse and Joe, as always, for all of your contributions to this 101 every year. And thank you, James, for always supporting us on our webinars. Hey, folks, I really want to see you in May. So please plan to come to our next webinar, and that will be on for our Advancing Racial Equity series. Have a good afternoon, and I'll see you in the Q&A session. Bye.